this newly discovered variant, which is called Omicron, has raised some alarm bells because of the number of mutations it has, particularly related to the spike protein. So remember, the spike protein is the part of the virus that really allows it to interact with human cells. It's also an important part of the virus that our immune system targets, that our vaccines are designed to imitate. So because of the importance of the spike protein, when changes are noted in that spike protein in a variant from mutations, it raises concerns among physicians and scientists. And a flag gets raised that says, hey, we need to understand how these spike protein changes could impact how the virus behaves, which is kind of what we've seen in the last week or so. Number three, that being said, the current vaccines we have for SARS-CoV-2 to date remain incredibly effective in preventing hospitalization and death. Current vaccines continue to be effective, even though those vaccines we have were not specifically made for some of the newer variants like Delta variant. And it shows that having a vigorous immune response to earlier strains of SARS-CoV-2 seems to be protective against some newer strains like Delta variant. And that continues to support the idea that our best protection against current variants and future variants is vaccination and maintaining immunity. It raises the prospect of the importance of booster doses of vaccine, particularly for the most vulnerable in our communities, including those over the age of 65 and those with other health problems. However, as others on a national level have said, we'll not be able to boost our way out of the pandemic, and much of our focus really should be on getting the unvaccinated vaccinated. So there are some things that we don't know about Omicron in particular. So, number one is we don't know the impact that mutations on that spike protein in the Omicron variant will have on virus behavior. Things like, does it make it more transmittable? Does it make disease more severe? Does it make the virus have the ability to avoid the immune response created by previous COVID infection or COVID vaccination? Will our current therapies like remdesivir and monoclonal antibodies and these newer antiviral agents like molnupiravir and Paxlovid, will they not work as well? There are some anecdotal reports from around the world that the disease caused by Omicron has been mild, but those are often in younger individuals. So we don't know what the disease will be like in those who are more vulnerable. There are also some reports that individuals who were previously vaccinated still got an Omicron infection. So it's going to take a couple of weeks here to have a better understanding how the variant's behaving, and then what adjustments in pandemic strategy will be needed. So, as I mentioned, we knew this was coming. We're prepared to deal with it, and vaccination remains our best bet in protecting ourselves against these newer variants. So